Hello, I'm Dr. Michael Ackland, and today I want to talk to you about an interesting advancement in regenerative medicine, neurogenic stem cells. I'm sure you've heard about stem cells, and if you've done some reading and investigation, you've probably heard about mesenchymal stem cells in particular. Mesenchymal stem cells can be obtained from human umbilical cord cells, and let's call them MSCs for short. MSCs have been used for several years now. They can be administered and then hopefully will differentiate into specific cells that you would like it to become. For example, cardiac cells, cartilage cells, or nerve cells. Recent advances, however, have allowed us to program these MSC stem cells into a specific cell line, such as neural stem cells. These specialized stem cells have shown promising potential in aiding the recovery of partial nerve cell damage and supporting neurological repair. The nervous system has a very limited ability to regenerate on its own, especially when nerves are partially damaged due to injury, stroke, or degenerative diseases. However, with these new advances in stem cell therapy, there has been an introduction of innovative ways to enhance the body's natural healing process. These neurogenic stem cells from human umbilical cord mesenchymal stem cells are particularly effective because they can create neural-like cells, release growth factors, and create a more favorable environment for nerve regeneration. So how do these cells work? They can be injected IV or administered directly to a specific area depending on the condition being treated. There is hope and research is needed to determine the potential for promoting neuronal growth and repair, reducing scarring that impairs healing, myelin regeneration, which is essential for proper nerve function, and it can also enhance communication between neurons, improving recovery outcomes. These effects make them a possible candidate for treating conditions like peripheral nerve injuries, spinal cord damage, and post-stroke recovery. Scientific studies have shown that these cells secrete neurotropic factors, which play a crucial role in stimulating the survival, growth, and differentiation of neurons. These factors help create a regenerative microenvironment, assisting damaged nerves in rebuilding their lost function. Additionally, neurogenic stem cells may help modulate the immune response, preventing excessive inflammation that can further harm nerve tissues. One of the biggest challenges in nerve regeneration is the time it takes for nerves to heal. Traditional treatments often focus on symptom management rather than actual tissue repair. With neurogenic stem cell therapy, the aim is to provide a more direct and regenerative approach, potentially reducing recovery time and improving functional outcomes. Research is still ongoing, but early findings indicate significant improvements in motor and sensory function, especially in cases of partial nerve damage. Classic teaching has always been that cells cannot cross the blood-brain barrier. This is true for healthy people. However, with some recent research in conditions such as Alzheimer's, the research has shown that the blood-brain barrier is actually damaged in those conditions and allows cells to cross that same blood-brain barrier. Early applications have already demonstrated positive results. Patients with partial nerve damage have reported improvement in motor function, sensation, and overall quality of life after undergoing treatment with neurogenic stem cells. Please remember, a lot more research has to be done, including more clinical trials with large numbers. No clinician with any experience would promise a certain result, and you should look upon this treatment as a possible chance for improvement, and it's still considered experimental by many governments. At Boston Health Polyclinic, we're dedicated to providing cutting-edge regenerative therapies tailored to fit each patient's needs. Our goal is to advance patient care through the latest medical innovations and evidence-based treatments. Neural injuries are notorious for being very difficult to treat, and we want to bring every weapon possible in the fight to bring patients the best possible results. Neural MSCs possibly offer a way to not just manage symptoms, but to potentially promote healing and regeneration. Thanks for taking the time to learn about this topic with me today. If you have any questions or want to explore this further, feel free to leave a comment or reach out to us. Remember, it's not just about lifespan, it's also about health span. Take care. I'll see you in the next video.